As we enter the new fiscal year, the spotlight is certainly on the Gauteng Health Department's handling of backlogs, particularly when it comes to treating cancer. These delays have prompted questions about the department's strategies for the current period. Let's unpack this with the director of the South African Medical Research Council at UJ's Pan-Africanist Center for Epidemic Research. That's Professor Refilwe Phaswana-Mafuya, who joins us now via our video link. And Prof, it's great to see you. Thanks for your time and patience. Backlogs in the health department have been well documented for years, whether it's DNA results or any kind of cancer treatment. What's your sense about how well government is doing at clawing back at this backlog?
Thank you very much for having me. And thank you for the $1 million question. The backlog is real. In fact, I know of extended family members who are waiting for the same treatment. I believe, in fact, the evidence points to the fact that we need new models of care. We need service delivery adaptations. We need improved healthcare outcomes for all in the urban, rural, the employed and unemployed, people across racial groups. We cannot have a situation where people who are in their situations with low socioeconomic background and the persistent health disparities being experienced, we can no longer afford a situation where they continue to be left unattended. I think the department needs to seriously consider new models of care to salvage the situation. And because this worsen disease severity, transmission, they worsen death. In fact, they lead to death. And so we need urgent action. I hear about the different categories of allocation and so on. The point is people are sick and they are sick to death now. They need treatment now. And that is a moral issue in terms of the Constitution of South Africa, that health is a right for all, and the SDG 3, equitable health, and they are very outcome number 2, a long and healthy life for all. So there's a need for urgent attention to this matter.
Yeah, and something tells me the department has heard this before, and one has to wonder where things are going so horribly wrong. I mean, we're now dealing with an instance where we're told millions that have been allocated to treat cancer patients hasn't been used, while cancer patients sit at home with secondary cancers developing and some of them dying. I struggle to kind of pinpoint how a situation like that could come about when the money seemingly to help is there.
The public health system has dwindling infrastructure, is under-resourced, it has competing health priorities, and is faced with a high disease burden. Hence, a radical response is needed that would transform the healthcare system. As you know, we have a public health system that caters for 80% of the total population. Meanwhile, the private health sector caters for 20% of the total population. Now, with such health disparities, you definitely need to resource the system, the public health system, to be able to improve the health outcomes for all.
Yeah. If I understand the department's explanation so far, it sounds like what they are hoping to do is to get more equipment, get more infrastructure ready with the hopes of being able to treat more patients in the future. Does that make sense for you? Is that the way to go?
That is important in the long term, but in the immediate, there has to be treatment for people.
Right.
You basically cannot let other people die while in the meantime you are thinking the future. We have to address the context now and also plan for the future. I mean, how can one digest the fact that you've got people literally dying, and on the other hand, you've got money that is spared for the future? That, for me, tells me that there's a bit of inadequate strategic planning somewhere. There's a bit of lack of targeted approaches in budget allocations, and probably, and as we have known, actually, there's insufficient investment in healthcare, in laboratories, in overall healthcare infrastructure. Yeah. So I do understand the dilemma that the department is in, but prioritization optimization and targeted approaches are going to be key.
What adds to the concern, of course, is that there are so many specialists, especially in oncology, who are keen to do the work but simply do not have the tools to carry this out. And I've personally seen in my own kind of, reporting on this, some experts actually deciding to leave the public health sector because their conscience doesn't allow them to continue operating in a context where, frankly, they can't do anything to assist. That kind of dilemma, that kind of crisis doesn't help.
Yeah, we are living in the 4IR. The department needs to have innovative service delivery mechanisms. And I really am looking forward to the implementation also of the NHI, because the NHI will force us as a country to have synergistic efforts, to improve the public health system, and it will ensure that we meet our SDGs and the constitutional rights of the people and the very strategic objectives of the department. It will guide us towards equitable health care. So I think that we are the battle in as far as improving health and the lives and the health of the people is far from over, and we need dedicated, committed leadership to ensure radical transformation.
It's interesting you point to NHI as a potential reason. And of course, the story here is that depending who you ask, the president is just a few steps from signing the bill into law. But of course, critics have always been concerned that all NHI will do is help transfer what is dysfunctional in the public health sector to the private health sector. In other words, those backlogs that we're seeing because of the burden and the demand will just be transferred to all aspects of health in the country. Are those concerns unfounded?
There could be such concerns, but having the NHI implemented will force us into synergistic efforts, like I said. I mean, how can we allow a situation where the private health medical care is accessed only by 20% of the population due to affordability and accessibility, and live comfortably with our moral conscience clear when 80% of the population die because of lack of means, where their living and working conditions subject them daily to disease, severity, and death. So I think that if we put our efforts together, whether there will be more cost implications, whether there will be bureaucracies or some administrative issues or some job losses, life comes first, health comes first. We just need effective leadership and management.
Yeah, and that's exactly the question I was going to ask you, because what you're pointing out is a supposed disparity when it comes to resources. But some people will tell you that the health department or the health sector doesn't have necessarily a resource crisis. It's got a management crisis. The money and infrastructure we have is not being used optimally. And that's why we're seeing such poor outcomes in that sector.
Yeah, I believe there's somewhat a lack of management and leadership in this regard. Look, one has to also look at it in context. Maybe when you look at it from outside, you can just throw the stone. The question for me will be, what are we jointly doing? I mean, with an overwhelmed public health system, having so many priority needs, on health, we know the South African health system has done tremendously well, for example, in having the largest ART program in the world. But then on the other hand, you've got new infections not stabilizing to the degree that we've wanted, and therefore the treatment program being bigger, getting bigger and bigger, and resources dwindling and so on. So I would like to say, it's a bit of everything. Let me put it that way, because I don't think it will be fair to just say it's lack of leadership and management. It's lack of resources, lack of infrastructure, an overwhelming majority of the population that depend on such a system, and then you've got management and leadership that in some cases, is not adequate. The department is under-resourced, and then and there's lack of skills in some respects, and so on. So it's a complex issue that requires a multi-sectoral approach. It requires a huge investment in resources. It also requires leadership that is visionary and transformational. Yeah.
Absolutely. Yeah, it's a good point. It certainly is complex and lives at risk. So hopefully we'll be able to get a solution rather sooner than later. Professor Refilwe Phaswana-Mafuya, thanks very much indeed for speaking to us.